And without further ado, again, I'd like to introduce Dr. Caroline Apovian, who is going to talk to us about obesity and breast cancer risk. I will stop sharing my screen so that Dr. Apovian can share hers, and I hope you all enjoy the morning.
So I'm going to talk specifically about diet, weight issues, and breast cancer risk. And the bottom line is that obesity, which is a disease, is associated with a 35 to 40% increased risk of breast cancer recurrence and mortality. So that's recurrence. What about risk of breast cancer for those who gain weight and who have obesity? And I'm using the term obesity just to make sure that people understand that obesity is a disease just like diabetes and high blood pressure. And so we're not talking about, a few pounds here and there. We're talking about a disease. And this is a schematic of how we measure weight gain and those who are overweight and those who have obesity. So you are of considered normal weight if your body mass index, which is your weight in pounds divided by uh, your weight in kilograms, divided by your height in meters squared. So that's, there are nomograms. You can go on the web and calculate your BMI. You have normal BMI if your BMI is between 18.5 and 24.9. And overweight starts at a BMI of 25. Obesity, the disease, starts at a BMI of 30. And there are different classes. And why do we care about this? It's a measure of how much fat tissue, adipose tissue there is in the body. It's not perfect. We know that, there are elite athletes who have a lot of muscle mass, which weighs, and their BMIs are high. But this is a good, rough idea. It gives you an idea of adipose tissue. And the more adipose tissue you have, the more chance you have adipose tissue that can cause other diseases through inflammation, and I'll talk about that. So there is an association of risk of postmenopausal breast cancer among women, and that is, the risk of breast cancer among women increased by 11% for each 5 kilograms or 11 pounds of weight gain in adulthood. That's a rough idea of the association between the risk of having postmenopausal breast cancer. Premenopausal is a different story because it's more influenced by other by genetics and other aspects. Postmenopausal breast cancer has a pretty strong association with adipose tissue. So how common is that? Well, you've probably seen these kinds of graphs before, so I'm not going to really spend too much time talking about how common breast cancer is, but roughly about 15% of all new cancer cases in the United States. Median age at diagnosis is about 63. So overweight and obesity can drive cancer progression, and I'm talking about here many different kinds of cancer. But cancers of the breast and prostate in men are among the most commonly diagnosed and among the leading causes of mortality of cancer in women and men respectively. So that's why we really need to focus in women on breast cancer and the risk. And this is the problem with breast cancer and obesity is that they've increased in prevalence. And do we just have a random association, or is there really a link? That's the key here. So we really need to understand this. So I'm going to move now to talk about how obesity in general, excess fat tissue, causes disease. We now know since the discovery, and that was in 1994, that fat tissue secretes hormones that then go to other organs to cause disease. So, how does it do that? It's an active endocrine organ. So, it turns out that the more fat you have, the more the chance is that you secrete these hormones and other peptides that then cause inflammation. And so, the key here is that excess fat causes inflammation, and that can affect cancer risk. So, and what are other aspects of excess fat tissue that can influence cancer risk besides inflammation? So, we have the production of excessive sex steroid hormones, such as estrogens and in men, androgens, but also in women, some androgens, and we know that that affects cancer risk. There are excess adipose tissue can cause excess secretion of insulin. And we know that insulin can affect cancer risk. And also, there's the production of other kinds of insulin like growth factors that can uh, enhance tumor growth. So, that's also produced by fat tissue. And then there are actions of other hormones in adipose tissue, leptin and adiponectin. These are just other hormones, and I will talk about those. So, and then again, as I said, inflammation can cause oxidative stress and reactive oxygen species that affect the body's immune response, and that can affect cancer risk. So, what are some of these mechanisms? So we have the inflammatory cells. We have here inflammatory cells causing inflammation, and what do they do? They can activate key signaling pathways that can increase the activation of tumor cells. So if you already have a genetic predisposition to develop increase in tumor cells, then this adipose tissue inflammation can act as an activator of that process. So, and then as I said, there are other hormones that can do this: insulins, growth factors, steroid hormones, and adipokines coming from fat tissue that can also do this. And all of this affects a tumor microenvironment, we call it. The reduction in beneficial immune cells and the activation of pathologic immune cells from fat tissue we know occurs, and that can also affect the immunity surrounding the tumor microenvironment. Again, if you have a genetic predisposition, that can activate, again, activate and alter the tumor microenvironment milieu to increase the chance that these tumor cells would grow. So I know it's complicated, but all of this, all of the secretions of inflamed fat tissue can enhance breast tumor progression. Okay. So how does gaining weight do this? So you have uh, women who have normal weight and a normal degree of fat tissue, normal structure and function. That means the fat cells are rather small. If there is a weight gain, however, and some of these fat cells are not meant to hypertrophy, but they are forced to hypertrophy because of weight gain, you get more lipid accumulation. The fat cells break apart, and lipid goes into the microenvironment, and then you have immune cells that surround and try to pick up the debris, and that's the beginning of inflammation. So that's how it works. And then again, these it becomes dysfunctional adipose tissue that then secretes excessive estrogens, lipid metabolites, inflammatory cytokines, and adipokines that then go into the bloodstream and wreak havoc in other areas of the body, including breast tissue. So that's what happens. We know that leptin levels go up in this case. Leptin is involved. Studies have shown leptin is involved in mammary tumor development and progression, and adiponectin levels drop. And this is one of the only beneficial adipokines coming from fat tissue. And when you have this increased inflammation, you have less levels, and this high levels of adiponectin can protect against breast tissue progression. So that's how it works. Still very complicated because we're not sure. So first of all, not all women who gain weight develop inflammation. So that's the other thing. You have to have a genetic predisposition to developing this inflammation. And then you also have to have a genetic predisposition to developing breast cancer. And if all three are confluent, then this is how the progression to an increased risk of breast cancer occurs. So, can we modify diet to reduce the risk of breast cancer? It looks like we can modify diet or alter diet towards a diet that can reduce inflammation to reduce the risk of breast cancer. This is true. So how can we do this? Before we talk about that, we're going to talk a little bit about alcohol because that's part of the diet. Alcohol, how do we think alcohol can cause cancer? So it's not about it's about the amount of alcohol. If a small amount of alcohol is ingested, and it's small, we have different definitions of small for women and men. ADH is an enzyme that converts alcohol to acetaldehyde. So if a small amount of alcohol is drunk, the body can process it, passes through without doing much damage. If a large amount of alcohol is drunk, body can't process it fast enough, and that's the key here, fast enough. So there's a buildup of this acetaldehyde, and acetaldehyde is toxic and can cause DNA damage, and that's the issue, is the DNA damage that can lead to higher risk of breast cancer and other cancers. So what is the amount we're talking about? An extra 20 grams a day of alcohol in wine can increase the incidence of breast cancer by 18.6%. What's that mean? An extra glass and a half, something like that. And so we have these limits. The limits to alcohol intake that has been considered to be less risky is one drink a day for women, and in men, no more than 1 to 2 drinks a day. And that's based on all of the studies linking alcohol with increased levels of acetaldehyde and breast cancer. What about the role of diet? This is also very complicated. It's always been shown that healthy dietary patterns may decrease breast cancer risk. And what is a healthy dietary pattern? High intake of vegetables, fruit, and interestingly, foods with low fat content. That's always been promoted by the World Cancer Research Fund. And what does this come from? There was a study now quite a while back, 2006, linking dietary fat reduction with lower risk of breast cancer. And it was a trial that looked at women who had early breast cancer. All right, so it's really linking recurrence. And there were two two arms of the study. One was a control arm where women had where women were eating a certain fat content, and then a dietary intervention arm to reduce fat intake to a very low fat diet. So I'm not going to go into the different kinds of diet, because the bottom line here was that it the study showed that women on the low fat diet had a 24% fewer recurrence chance of breast cancer than the control group. It was very controversial because they also lost 5 pounds. So was it the low fat diet that reduced the risk? Was it the increase in fruits and vegetables, or was it the weight loss? And in the end, does it matter what it was? Because there was that diet showed lower recurrence of breast cancer. And then the reason why we think doesn't matter what it was is because it was a healthy diet. And so we know other things about healthy diet, that vegetable intake can also, the higher the vegetable intake, the lower hazard of breast cancer recurrence. And this is in women who've already had breast cancer, but I think we can really apply these findings to breast cancer risk in general. Cruciferous vegetable intake, doesn't matter what kind of vegetable, that's another issue, but I think that in general, all kinds of vegetables can lower breast cancer risk. How about serum estrogens? So again, this is linked with weight, because we have higher serum estrogens and androgens in obesity, and weight loss has been shown to have a favorable effect on the hormones that we're talking about, estrogens, other hormones, insulin and leptin. When you lose weight, these hormones are lowered, and then there is a lower risk of breast cancer because of this. So the bottom line is that weight loss can help here. So I just want to summarize. We have an increased risk. There's an association between obesity and breast cancer risk, and breast cancer recurrence. The risk of postmenopausal breast cancer, now we're talking about postmenopausal breast cancer, increased by 11% for each 5 kilograms of weight gain. That's what we know. We also know from the study I just mentioned that weight loss will reduce breast cancer recurrence. We now need to show with studies that weight loss will reduce breast cancer risk in general. What we do know, however, is that reducing dietary fat, increasing vegetables, fruit, and fiber may protect against breast cancer. What we're not really sure of is it the quality of the diet, or is it the weight loss? I feel, and many of us in the field feel, that it is a combination of both of these moieties, weight loss and dietary quality, healthy fruits and vegetables, lean proteins, low-fat dairy, that combine to produce a decrease in breast cancer risk. So I'll stop here, see if there are any questions. Thank you so much.
Thank you, Dr. Apovian. I don't see any questions in the chat. I'm sure that some may come up as the morning goes on. I'll ask you to stop sharing your screen if you could. Perfect. Thank you. All right, so we are going to move on then. Let me see if I can share mine. The next speaker this morning is Are you I'm sorry, I'm just going to ask a technical question. Are you all seeing my screen again?
Yes.
Okay,